So good afternoon and good morning, everyone. Welcome to today's SRAE webinar on gaining community support for sexual health programming. My name is Patrick with RTI, and I'll be helping out with the virtual room today. Just a quick note, when you log in, your microphone and web camera will be automatically muted. If you have any questions for presenters today, please submit those into the Q&A window at any time. And you may also click the raise hand button if you'd like to unmute and ask your question out loud following the slides. If you run into any technical issues or have more general comments, please put those into the chat window. Closed captions are available during today's webinar. Just click on the Show Captions button on your main Zoom toolbar to turn those on. And at this time, I'll go ahead and turn things over to Taya to introduce us to today's session. Thank you.
Thanks, Patrick. Good afternoon, everyone, and welcome. My name is Taya McMillan, and I'll be a facilitator today, as well as a co-presenter for today's webinar. We're going to take a few minutes to walk through our agenda as well as objectives. So first, we'll be taking a look at mental models, trust, and community engagement. And then we will have an overview and application of the community support resource. And then we will wrap up with some discussion and close out. Next slide. Here are our meeting norms. As always, we want everyone to participate and engage. Your voice is important. We want to hear from you as well as your colleagues, and please make a room and allowance for your colleagues to be heard. We also want everyone to be fully present. We know sidebar conversations and chats and cell phones are tempting, but we want to make sure that we maximize engagement and that everyone is focused on the information that we'll be sharing this afternoon. And last, we want to make sure that we begin and end on time to respect everyone's time. Next slide. Here are objectives for this afternoon. So at the conclusion of today's webinar, you'll be able to understand why concepts such as mental models and trust are important to keep in mind. You'll also be able to use practical information and tools to expand community buy-in and disrupt misinformation. And last, you'll be able to implement key recommendations to facilitate community engagement and also promote sexual health programming. And with that, I will hand it over to my colleague, Brian Southwell. Brian?
Great. Thanks so much, Taya. And thanks to all of you for being here today. We've been looking forward to talking with you. And this is always a good opportunity to thank you all for the work that you're doing. It's really crucial at this moment. And so what we wanted to do today was actually to step back a bit and offer some foundational concepts that we think could be important as many of you are charged with the task of gaining community support. And what's important about this is that often folks will say, well, of course, it's going to be important to have community support in order to implement the programming that we're attempting to offer here. But it's easier said than done, of course. And I think there are some fundamental aspects of how communities operate, of how audiences of messages operate that sometimes get overlooked. And so what we wanted to do today was to hopefully offer a little bit more of a concrete exploration of what sometimes can be some buzzwords, and to then offer some examples. And as we will here, when I turn the floor over to Taya, walk through what is, I think, a very helpful resource that could be useful for many of you as you do the work that you do. So if you could turn to the next slide, that would be great. So one idea that we want to start our conversation with has to do with something that every one of us carries around, every day, in our brains, and that is our mental models of the world, of concepts of how everything actually works. And what's important, I think, to keep in mind with this concept is that although we might have new and exciting content to offer, we might have new messages, we have brand new material. It's really important to keep in mind that the people that we're reaching out to with all of what we're excited about themselves are not blank slates. They are bringing to any communication with us a whole lifetime of lived experiences. Within a community, there are various ideas that have been in circulation in that community. There are shared histories. Is just an awful lot that we ought to keep in mind. And so one way that folks have started to think about this notion is, this concept of a mental model, and I'll walk through what I mean by that here in just a second. But what is important, I think, to keep in mind is that a mental model really guides the reception of new information. In a lot of ways, there's an architecture we can assume in each one of our brains that comprises those lived experiences that we've had, and it comprises the knowledge that we're bringing, and that's really what we're using to then engage with new information in a lot of ways. And so it really is important and incumbent upon folks who are putting together programs and different projects to really have a keen sense of what it is that the people have in mind to begin with. If we can move to the next slide. I'm going to ask a question here that I want each of you to actually think about for a minute. If I were to ask you, this basic question, what is a house? Upon me asking that question, something comes to mind for each one of you, and you could sketch off to the side or write down for yourself what it was that comes to mind. But I imagine each one of you has a mental picture or some ideas or some concepts here in response to that question. And I could ask a little bit later on, I'm going to ask you to use the chat to describe some different ideas. But for now, I want you to think about what it was that actually comes to mind on this very basic question. Something that you'd think perhaps everybody would be in agreement with regards to, but actually in reality, there's probably a pretty wide variation amongst all of you that are on the call right now. So if I were to ask and it were to take a survey of what everybody had in mind, I would expect there to be different types of examples. And we can see here a couple that I've anticipated. For some of you, you might have something relatively basic in mind if you move to the next slide here. And you might have something like this. Perhaps you have limited artistic abilities, or maybe you just haven't really thought very much about this question, but you've got this representation in mind. This, to you represents, a house. And that's perfectly fine. It might work perfectly well for the conversation we're going to have. But for others of you, perhaps who have had experience, helping to build a house, or you've got grand plans for some place that you're going to live in the future, or you have other ideas, that might have been informed by your past experiences, you might have something more complex in mind. And both of these representations are houses, and yet they suggest different possibilities for audiences. And this is important, I think, for us to keep in mind. It's not to say that we necessarily are just thinking in terms of being more or less complex. We might be thinking about all kinds of different dimensions here that might vary, even when we're using sort of basic language, to signify, a simple concept. So if you move to the next slide, here I want to suggest that there have been lots of instances in which mental models actually matter quite a bit, for public health and public health communication efforts. And this will start to make, the example, much more, or the concept much more relevant for what we're talking about here today. One direct example that we discovered a number of years ago came about in the context of the Zika virus, which might seem like a very long time ago. Now on the other side of this most recent pandemic that we've been living through, but for a while, Zika virus was in the news, and it was quite salient for a lot of people. It was particularly salient for people that were living in certain parts of the world. And so Guatemala was one of those places that was worried and concerned about Zika virus, or there was a sense that this was going to spread there. And we went and had staff work with different residents in different parts of Guatemala to get a sense of their understanding of Zika virus as a public health threat, as a disease. And when we did that, people had a lot to say, actually. And it was really fascinating, to listen to all of their conceptualizations. But one of the things that we realized was that in Guatemala, It's a place where there are many mosquito-borne diseases. Chikungunya and dengue is, two prominent examples that have really affected populations there. And much of what people were talking about was about Zika virus, as yet another mosquito-borne disease. And so it was clear that they were thinking about this having been conditioned by the experiences of chikungunya and dengue, which are serious diseases, of course, and there's a lot, there to be concerned about. But what was missing, because people had been informed by, the past experience with mosquito-borne disease, was that actually, by and large, there was a tendency to overlook a novel twist, a novel aspect of Zika virus, and that is that Zika virus can be sexually transmitted as well. And so that had a lot of implication for the engagement work here. It wasn't as though we had to introduce, Zika virus as an altogether, new idea or concept, but there were important aspects of transmission that were essentially left out of the mental model of the audiences that we were going to engage with. And so if we hadn't known that, before, working further, we would have been missing something really important. And perhaps we would have emphasized, something that people already knew, and perhaps we wouldn't have sufficiently emphasized this important element of transmission, which turns out to have been important to keep in mind for Zika virus. If you move to the next slide, here then is a phrase that we're all here to talk about here today, sexual health. And this phrase is one that you might use in your programming. This might be a label for projects that you are working on. And the question for us here today, though, is from the standpoint of community engagement, what are the mental models that people are carrying with regards to what constitutes sexual health? And it's a fairly general phrase. And so it's really an important question, I think, as to what it is that community members might believe and think about this concept. So here is a place where I'd like us to take advantage of the chat just for a second. And what I'd like you to do here is not to put into the chat your extensive knowledge of sexual health, of which all of you on the call have quite a bit. But I want you to think about what it is that you think members of the communities that you're working with think about. What first comes to mind with the phrase sexual health. And here there's no right or wrong answer, but I do want you to reflect on what you think people in your community might think about, at least initially, here. Some of this might be, you might view it as problematic, and some of it might be right, exactly what you want people to be thinking about. But put some ideas into the chat here for what you think, what you believe community members think about this concept of sexual health. And we'll take a look here at the responses as they come in, but you can go ahead and use the chat function for that. Okay, Maya's started us out here with a reference to STIs or STDs. Excellent. Stephanie has moved the discussion in a different way, that perhaps what comes to mind for people is the relevance of this as a topic, and that it might be relevant for some community members as a topic that gets covered in high school, but perhaps not for middle school. Josh has pointed out, not only the potential, disease portion of this, but then also thinking about contraception. We've got Tanya is noting taboo and the possibility of discomfort. Jill is assigning or suggesting that community members might think it's important but difficult to discuss, right? Ada points out this notion that sexual health might be defined in terms of sex with a single partner. And Ashley is noting here that this is perhaps a topic that is best dealt with in the context of family and parental discussion, but not from outside organizations' perspectives. This is such a great array. Even just these handful of answers here initially suggest that this is going to have a lot of different associations for different people. There are some folks that are going to think about this in a very technical sense as to what harms we might be thinking about in terms of disease, prevention or pregnancy. But then there are others that are thinking about this as a construct that's affected, community discussion, that there might be some emotion attached to this. For some people, that there might be a sense that this is or isn't something that it's okay for us to be talking about. And why then would we want to keep all that in mind? You might have a perfectly what seems to you to be an innocuous, flyer advertising some effort. You might have something that's going to go out, in the mail, and it seems like you have spent a lot of time making sure that there's nothing controversial in what you are, putting out there into the world. But the mere fact that you might have a phrase like this, or any reference to language like this itself is going to possibly prime and activate some of these ideas that people already have. And that's, I think, one of the most fundamental aspects of thinking about communication and community engagement is that which you might stir up, that which you might prompt or activate in a community is equally as important as what you are bringing, to the situation. And so this is going to be crucial. And so I think that many of you that have put these ideas in the chat, this is great because you're already going to be anticipating some of what you might run into when you're raising these particular ideas. So if you can move to the next slide, please. So one idea that you might run into, or one type of idea that you might run into, is one that's going to be particularly problematic for your organization, and that is a misperception that a community member might have. And that misperception might be the result of formerly misinformation that's actually circulated in your community. And this is an important concept. I know this is one that a lot of people are struggling with in different ways, because you're realizing that what you are putting out there into the community, you're not operating in a vacuum. You don't have the ability, not only are communities themselves not blank slates, but also the information environment itself is not a blank slate. There's a lot of potentially competing information. Some of it is complementary, some of it comes from other organizations, and some of it is just not grounded in science and not grounded in the truth as your organization understands that. And that's a real problem for you, because you can't just ignore what's out there. We know that people may have been affected by misinformation. We know that the information environment that we live in now makes it possible for people to not only encounter misinformation, but also to share it with 1,000 of their closest friends with just the click of a button or a simple swipe on their phone. And so we worry about the quickness with which and the speed with which misinformation can spread. And we worry about the fact that it might actually overwhelm or undermine what it is that we're trying to do. So there are at least 4 reasons why we can't just dismiss this as a problem. And I want to be as optimistic as possible here today. And I think that ultimately Ty and I are going to offer, I think, some real reasons for optimism. But what I want to suggest to start is that there are a couple of reasons why we can't just ignore misinformation, and most importantly, why misinformation is a problem is one that there are a number of explanations for, but ultimately, I think the best way to address it is going to be for us to take a stance of empathy for our communities that we're working with, because the situation we're in is actually understandable. The situation that we're in is one that has arisen partly from some different dynamics that I'll talk about here in just a second. But this is going to hopefully be the basis, the answers to these, this slide here that are the ideas that I'm raising on this slide are the basis for a stance that I think is a little bit different than sometimes people have raised. I don't think that our way to address misinformation is just to go out into the world and assume that we're going to combat all of it and vanquish it from the internet. That's not likely to happen. But instead, what we have to do is help our communities navigate through what's a bewildering and challenging information environment. So the first idea that I want us to keep in mind is that actually, as human beings, we generally, what we understand about information processing suggests that people take in information and, at least for a millisecond, at least for a bit of time, have to accept it as reality, because that's how we process stimuli. So it's not as though we can magically keep away misinformation. We actually have to take in and process it. and make sense of it. And sometimes people are tired, sometimes people are distracted, sometimes people don't have the background or the expertise in order to make sense of it. So it's going to make sense that some of this is going to get through, and is going to lead to some misperception. So just our basic human nature suggests that misinformation, like misinformation, is something that when we encounter it, we've got to expect that people are going to at least engage it for a minute, and that might be a problem. It might open the door for people to be engaging it just long enough to share it with 1,000 of their closest friends. Well, speaking of sharing information, we're also social beings. We know that human beings are social. We like to interact and come together on webinars to talk. We know we like to talk, to each other, even in the elevator. Here, there are all kinds of reasons why you see somebody that you know and you spend some time actually, chit-chatting with them. Sometimes what you're talking about, though, isn't necessarily something particularly new. So go back to that example of the elevator. You see somebody walk into the elevator that the two of you talk about, the turn in weather that we've had, here in North Carolina. It got a lot colder, overnight, and I can imagine talking with a colleague about that. But when you have that kind of conversation, that kind of small talk conversation, you're not really sharing anything factually, new for the most part. You're talking with people to acknowledge them. You're saying you're part of my community. I want to acknowledge you. I'm not necessarily worried about the exact accuracy of what I'm saying or how carefully vetted this fact is that I'm sharing with you. And so because there are all kinds of reasons why we share information, we can also imagine that sometimes people share misinformation for similar reasons. Sometimes they're just signaling that something's outlandish, or that, oh, hey, look, I know you might find this funny, or you're part of my community. And we've got to deal with that as well. So this is going to be something that some of these myths, some of these misperceptions are likely to have spread, partly not necessarily always for malicious reasons, but because of just the nature of people engaging and talking with one another. We also have to recognize that in a country like the United States, we oversee our information environment to some extent, but we don't typically tend to censor a whole lot. And in fact, when it comes to medical and health misinformation, there are some instances in which there are claims that you'll get in trouble if you make, but is usually only after they've been made. As you think about something like the Food and Drug Administration, which does regulate claims about regulated products, but they do so by finding out about so-called bad ads, and then there's remedies, that are people have to often respond to. But it's not a matter of any one, government agency sitting around and plucking, information off of the television set or off the internet before it even gets out into the world. So again, audiences are going to encounter some degree of misinformation because of the somewhat open-ended, nature of our information environments. Again, another reason to be empathetic, because any one community member might well have run into some of this because of the nature of the country that we live in, and that's a good thing. I don't think we'd want to argue for wholesale censorship. And the last thing I want to point out is that you can correct misperceptions, but they're difficult, to challenge sometimes. And correction is possible, but it requires quite a bit of effort, on the part of you to make sure that you are exposing people at the same level as the misinformation that they were exposed to. So if somebody hears something, that was nationally broadcast, and then you have a simple, very carefully placed, comment on your website somewhere that nobody ever sees, you're not fighting fire with fire. So for all these reasons, the only reason I raised this is just to suggest that we've got to think about how we can help navigate through information environments, how we can help people navigate through information environments, and not assume that we're going to be able to magically protect them. We're not going to be able to assume that somehow we can just get rid of all the misinformation that's out there. So if you move to the next slide, this in a lot of ways suggests the reasons why trust is so important. Ultimately, if you want to deal with misperceptions and misinformation, you want to deal with erroneous ideas that people might have, ultimately, you're going to have to work on building and maintaining trust. And that's really vital. At the end of the day, we've got to spend a lot more time than we typically do focusing on building trust and maintaining trust, and a lot less, I think, on blaming those that don't trust us. If there is a situation of mistrust that's unfortunate and tragic, what can be done to overcome that, as opposed to simply getting upset about it? And I think that's really the stance that we've taken in preparing a lot of the materials that Taya is going to talk to you about. But even trust itself, I think, is important to unpack as a concept. And this is something that might sound counterintuitive. Many of us understand trust to be a word that we've heard before, that we would use in our everyday language. But I'm not sure that researchers actually are sufficiently carefully defining what trust is. And we've actually learned some really interesting examples of instances in which we actually weren't really on the same page with our communities in terms of what they meant by trust. So if you move to the next slide here, I want to point out that there's a lot of evidence that trust matters. Another example, from the infectious disease arena occurred in the context of Ebola a few years back. And here in the U.S., the Centers for Disease Control and Prevention had a project which offered information to travelers who were coming from countries where there were Ebola outbreaks. And one of the things that they found was that the implementation of this project, whereby people were met in the airport and given information by a so-called care ambassador, it really mattered whether or not people trusted that ambassador as to whether or not they were going to adhere to the recommendations or adhere to the requests, for screening, for example, and monitoring, that were made. And so, trust is crucial when you're talking about cooperation, here. And so it's clear that this has to be something that we're really gauging and making sense of. And so to what extent is there trust or mistrust in a community? Obviously, that's going to be an important starting place for any project like this. If you move to the next slide, I will talk to you about some important considerations, though, about this concept of trust. So trust has meaning for all of this, as I said. For many of us, it won't surprise you that I might emphasize some sense of credibility here. And that's, for a lot of people, trust is something that reflects credibility. A person knows what they're talking about. But we've also found that for many people, trust also comprises a sense of consistency or reliability. And so you can see here instances in which guidelines change, for example, or recommendations change, where that can be problematic if people weren't anticipating that possibility of change. And then last, it's a really important dimension that I think often gets overlooked, is that for many people, trust has to do with a sense of shared interest as well. So if I think that I'm listening to somebody talk and I think they sure sound smart, they know what they're talking about, but I don't really think that they care if I live or die, that's going to be probably a different situation than, fundamentally you might respect somebody as being knowledgeable, but that might be different than whether or not you trust them. So this sense of shared interest, this sense of almost economic, shared interest, I think is really important for us to keep in mind, because it's not always clear, I think, for community members what you as an institution, what you as an agency or a program or a project really have in common potentially with this audience that you're trying to reach. To what extent have you made it clear how the goals of your program are really aligned and how there's a shared interest there on the part of your organization and the part of your communities? What can be done to actually further emphasize that? That probably needs to be a fundamental starting place for a lot of your efforts. And it's something that I think we skip right over. Sometimes, and don't try to bother to make that case. Now, the good news is that I actually think that that case can be made, that there are an awful lot of instances in which it's clear why you would care, what it is that your audience is, what your community members are doing. But you've got to make that more obvious than I think is often the case. So if you move to the next slide, I'll talk here about an example here in the North Carolina context, which we were working with communities to think about ways to better and improve how they received and got access to information about wildfires, that were ongoing and threatening their community. And something that we found was that not only did this conceptualization of trust vary in the ways that I've just talked about, but it also turned out that local sources really mattered. And we think our sense of this was that local sources mattered because there's a sense of shared interest, that you think that the local newspaper is more likely to have economic interests, well-being interests in common with you than some far off resource that is at a level of abstraction that you don't really understand, and that you're not really understanding what you have in common with the source. So if you move to the next slide, we'll talk about a couple of examples of this, of how when we think about community engagement, public engagement, we've got to do more than just simply present information. We've got to do more than just craft something that's spell checked and beautifully formatted, but rather to think about who is it that's offering that information, what is the source, how are we distributing that information, and what have we done to really think about some of these concepts that we've talked about here before. What have we done to reflect what's already in people's minds in terms of the mental models of the concepts that they're that we're talking about? What have we done to ensure that there's trust before we're doing this outreach? And is there anything we can do to signal even within the outreach or the programming that we're offering, that signals reason for people to trust us? So if you move to the next slide, just a couple of quick examples, and then I'll turn the floor over. In the context of HPV vaccination, we've seen here that two things that are really, I think, important for our discussion. The first is that people express varying levels of trust in different sources. And so you might have a source that's viewed to be authoritative, by one, part of the community and less so by another. And that's really important. So you're not necessarily going to want to emphasize the same source in all cases. And we also know that in many examples, in many instances, the folks that you're most directly connected to in your social network, organizations that you're a part of, can sometimes matter more than more abstract or official or federal sources, for example. And this was true. A paper a couple of years ago, looking in the context of HPV vaccination, found that for certain minoritized populations, there was greater perceived trust or greater expressed trust in sources like family members or religious organizations. And so you can imagine what the implication of that is for the strategy for how you're going to share information, or ways that you might actually want to bring into your planning efforts some of these network ties or similar organizations to be part of what you're doing moving forward. And I think that's a really important thing to keep in mind. Where people engage with information also matters. And there are many different sources here that I think are, and many different types of organizations, which I think can be thought of as unconventional, but really useful partners for a lot of this type of programming. If you move to the next slide, here's an example that many of you are familiar with, but I just want to raise it up here because I think this connects in really important ways. Here's an example of a paper from a few years ago focused on HIV prevention. And what they found, here was that ultimately barbershops as a place, for, community conversations were really important, for the Black heterosexual men that were, really the focus of this particular study. And so I think one of the questions that we might raise and that you all might creatively start to think about are, what are the equivalents of barbershops, in the communities that you are, working through? Well, what are the ways in which we can actually engage, organizations and sites like that, as partners for us, in different ways? If you move to the next slide, I want to raise this then as a question for you all to consider. We can think about ways that we can work with trusted sources, but what are also the ways that we can signal that there are ways in which there are shared interests between community members that we're trying to reach and our organizations? What are things that we can emphasize? What are things that we can signal, whether it be with the imagery that we're using or the explicit statements that we're making? The actions and activities that we engage in prior to release of a big program. What can we do to identify and spotlight and uplift the shared interests between organizations and people that are outside of those organizations who we hope to engage with our work? And this is a place where I want to encourage you to use the chat here just for a moment as well, just to brainstorm on this. What are some examples of instances where you think you've done that well in your programs? Instances in which you think you could do that better? Josh raises an excellent first example here of a company's mission statement. There's a place where you can directly state what it is that your interests are. And some of them, I think we just sometimes try to hide too much, or we try to be too acute or overly, diplomatic or politic in terms of, what we're saying. And I think sometimes it's okay to just state what it is that you're trying to actually get accomplished, and then to point out how that's in everybody's interests in different ways. But what are some other examples of instances where you've either done this or other strategies that you can think of that would help to identify what some of those shared interests are beyond what Josh has offered? You can just put your ideas in the chat there. We'll take a look. Great, Ashley. Sometimes it may be that we've actually got to do some work to figure out what common ground is, that we're actually sharing, what the common goals are. And we might have some organizational goals that may or may not be, fully aligned, that we also have to think about how those can be framed in terms of goals that the community actually has. We've got some great ideas flowing in now here. Listening always helps. Volunteering work, making yourself known in a particular community, discussions at networking meetings, outreach meetings, showing up at a meeting before the first time that you're trying to actually offer something at that meeting is a good idea. Shared interest in the outcomes, Cheryl, I think that's great. Partnering with other trusted community organizations and trying to not do so in a way that seems cynical, right? Doing so in a way that seems genuine, and pointing out the opportunities for shared interests. And then, as Ada points out, going to where people are. I think that matters. It matters not just for sake of convenience. It matters that you would bother to do that, right? It matters that you view your organization as operating in the same community space as other organizations. Why Ty and I are here today to raise some of this, ask permission to be in the space. Yes, Ashley, I think that's a great reminder and good suggestion. So much of what we're talking about here, this whole first part of what we're talking about, this is vital. And yet we haven't really talked in a very direct and targeted way about the exact rhetorical strategy to use on your message. These are all sort of additional considerations about your relationship to the community, what it is that people are thinking about and bringing before you even are reaching them with your messages, and what does trust mean to that community, and how are you actually working on that? This should actively be part of your project and not just the technical and factual accuracy of the statements and the bullet points in your main messages. And that's something that I think we want to point out in really important ways. Okay, so thank you for all that. Those are all really helpful ways to brainstorm. If we can move to the next slide, I'm going to turn this over now for some really practical resources to the great Taya McMillan, who's going to walk us through some resources that will be coming soon. And I really am confident that these are going to be helpful for many of your projects.
Great. Thank you so much, Brian. So this is a screenshot of the community support resource. It's being finalized. It's coming soon. We're right there at the finish line, but we didn't have it done before this webinar. But we're excited about this resource because it's really in direct response to what we've been hearing from the grantees regarding pushback in the communities, opposition and concern about programming, challenges with misinformation. So we understand that there's a great need for community buy-in and support. And so this resource is our response to these challenges. And it does have a number of strategies and approaches to help build community support. So we're going to spend the next few minutes walking through some of the contents that are in here. Next slide. So we approach community support from three perspectives or three pillars. The first being messaging, what are you saying and who's saying it? The second is misinformation, how are you addressing it? And last, dissemination. So those strategies and tactics that you're using to get information out to your program, about your program to your community. Next slide. So there's been a lot of well-documented success in pregnancy prevention and also reducing risky behaviors, but there's still, unfortunately, a lot of noise around the programming that is distracting from some of the broader aims of APP programming. So this is where messaging comes in. And as a youth serving program provider, you share a common goal with parents in the community, which is to equip and empower youth to become healthy adults. So if you're able to craft and promote messages that lead with the overall goal of your program, which is adolescent development, adolescent well-being, positive youth development, you're more likely to establish meaningful connections as well as build trust and garner support in your community. So this overall approach is something we call positive framing. So by shifting and expanding the focus of your program messages beyond the sexual health education piece and emphasizing the how of your successes, how they're achieved, through teaching about healthy relationships, setting boundaries and goals, self-regulation strategies, you're reframing your program success through this lens of adolescent development and well-being. So if you want to take this type of approach, it requires a strategy, something we call a message strategy, that's then going to promote the positive framing. So a message strategy has 3 bits of information that are key. So the first is your communication objectives. So why are you going to be talking about this particular thing? We can actually move to the next slide. Your positioning or your audience, who it is that you're going to communicate with. Who do you want these messages to target? And then last, what will you say? And where are these going to go? So knowing your why is very, very important, as you're starting off, because we never go anywhere. Like get in our car, we know there's a destination. So why we're going to the place. And so some common examples of communication objectives or your why for what you're going to talk about, you might want to raise general awareness about your program. You might also want to educate your community or different groups in your community about a particular issue that your program is addressing. And then there are other times you may want to just address misrepresentations about your program. Basically, this is misinformation and things that are just myths, et cetera, that are not accurate representations of your program. So within this context of messaging, this is a good place to start to begin thinking through what you're communicating and then why you're communicating it. Next slide. So misinformation, navigating those challenges. So this is a quote from an advisory from the U.S. Surgeon General. It talks about the effects of health information. And so just a few things. It's a serious threat to public health. It causes confusion, sows mistrust, harms people's health, and undermines public efforts. And far, far, far more, it's just very detrimental. And as a youth serving program provider, you're really at the front line, front and center to the effects of false information, rumors about your program, misperceptions. And so we also know that misinformation and disinformation can have polarizing effects. And then that ultimately can fuel questions about your program as well as your organization that ultimately undermines your credibility and again distracts from that real message that you're making a difference, that you're equipping youth with knowledge and skills to really grow and flourish throughout their life. Next slide. So now we're going to walk through some tips and strategies on how to address misinformation. Some of these may look familiar, some of them may be new. We are continuing to learn about new ways to address misinformation because we know we have a challenging information environment. We don't anticipate it changing. So we want to share what we know so far. And again, we're all continuing to learn about new strategies and approach. And before I jump into these tips and strategies, I want to say that misinformation is complex. It requires a coordinated strategy. There's not just a one single thing, like one and done thing that you do and it's fixed. There's a number of strategies and tips and things that you can employ to help mitigate misinformation about your program and just in your overall information environment. So the first one is to encourage compassion. So anytime you are planning to address misinformation, you should address it with compassion because most people are filtering information, including misinformation, through their personal values and beliefs. And so it's very easy to have emotionally charged topics get polarized very quickly. And so whenever you set out to address misinformation, do not approach it with anger or criticism or ridicule because you can potentially do more harm in your effort to fix something. The next is always encourage and empower information seeking. So that means looking for opportunities to educate your community about media and digital literacy. So that helps them be able to be better at analyzing the information in your community. And of course, whenever you're putting out information, make sure that it's accurate and easy to access. And again, that piece of the analytical thinking, encouraging that approach to the information, not just digesting it and running with it. The next one, engaging some sort of communications professional or media or PR. There are people that do this for a living, but if you have access either in your community or some other local level, even in your organization, if you can have some people that can provide guidance on how you can translate some of your programming messages and communications into messages that really resonate with your community, that is wonderful. In the guide that we developed, the community support, we also have some personas in there that you'll be able to take a look at, helping you craft your messages based on different segments within your community. The next is to collaborate. So looking for opportunities to collaborate with leaders, stakeholders, and other trusted sources or individuals in your community. As we know, that can take you a very long way. And this one is really important, learning what people are hearing. So it's always important to keep a pulse on that information that's circulating in your community. So aside from having ears and youth in your community, you can do things like social listening or social media listening. That's a term that's gotten pretty popular. And that's basically a process of just identifying as well as assessing what's being said about a company, individual, in this instance, your organization. It can help you understand, what questions and what knowledge gaps are out there circulating in your community. And then it can help you inform how you address misinformation, or there are particular areas that are threats in your community that you can kind of get ahead of. And also helps inform some long-term strategic decisions about your organization and even the services that you deliver. As an aside, there are a number of free social listening tools out there, brand mentions, Google alerts. You could do something as simple as setting your organization name as a Google alert, and you can see anytime it's mentioned, what the conversations are being had, what types of questions are out there. There are a number of free, you can literally type in free social listening tools, and these will also be included in the resource once it's available. Building trust. So look for opportunities to build and expand trust in your community. As you heard from Brian, trust is really a unique mix of perceptions, surrounded by credibility, reliability, shared interest. So some things that you might want to consider. I know we have a room or a Zoom room full of experts and very resourceful individuals. We heard some of this also in the chat, hosting community events, partnering with local organizations. You could do things like, back to school clinics, providing immunization, school supplies, linking others to various social supports and resources. There's, a long continuum of things that you consider. And I think that gets us all through that list. Next slide, please. So these are more information-based strategies. So things that you can do with information. So the first thing is to match and prioritize. So starting out knowing that there's no platform out there, no information platform that's exempt to misinformation. So it's not about if, but it's like when you actually encounter misinformation, what you first want to do is decide if you want to address it. If that answer is yes, then you need to respond in the same channel in which it was communicated. So if it was on X, formerly known as Twitter, or Facebook, or if it was in a newspaper, wherever that channel, where that information appeared, that's where you should address it. And next, you should prioritize what you want to address, because your message should always be direct, and it should be simple and as brief as possible. We want to fill in the gaps. So misinformation is easily adopted, when people have a lack of information about something or a limited knowledge about it. So it's important to clarify when something's not true. And so you're identifying those information gaps and then provide direct rationales or links and relatable examples to help fill in, make that connection for your audience. The next is one that I really, really like: correct early and often, because it is somewhat proactive. So when you decide that there's information that needs to be addressed in your community, start as early as possible and often as possible, because the longer misinformation is circulating out there without being corrected, the more likely people are to assume it's true. So it's important to also know that you should emphasize the facts that you want to say and repeat them. Repeated exposures to corrections and any counter arguments can promote accurate and well-informed beliefs. The next one is let data tell the story. We've probably all heard a picture is worth 1,000 words. So if you have a simple graph, a chart, any other data visualization that can address misinformation at a glance, it is great because it grabs your attention and it's easy to read. We also know that people process visuals faster and they retain that information longer. So whenever possible, use graphs, visualizations, and follow good design practices and keep it as simple as possible, which is a recurring theme throughout these. Neutralize information with inoculation. Inoculation is a proactive communication effort to warn about impending misinformation. So that means that you're providing the correct information to prevent misconceptions from even developing. So you're getting out there ahead of what you might perceive. So if you're doing your social listening or other activities or hearing certain commentary in your community, you get a sense of we need to address this before this is a wildfire. And this basically immunizes people against misinformation. So you kind of can expose them to, one approach is expose them to some weakened version, just like a vaccine of the message, and make sure that they're able to recognize the error in what's being communicated. And find the common good. We've heard that, a common ground. We heard that in our chat a bit earlier. So misinformation can be difficult to correct because it's, again, central to a person's identity, to their values, as well as their worldviews. So always affirm your audience's community or their sense of self whenever possible. So that means calling attention to their values and ideas and reassuring them that their concerns and interests are important versus, going in there and kind of railroading through and stating things, are not correct. You can focus on opportunities and then the benefits rather than the risks or the threats related to that misinformation. So one way to do this is to remind parents and caregivers and the broader community that you do share a common goal, which is equipping and empowering youth to become healthy adults, and that you must work together to make sure that youth have the support that they need, as well as the opportunities that they deserve. And the last one here is leveraging credibility. Credibility, again, as Brian shared, is a really important factor for whether corrections, what the information that's shared is believed or not. And it's really made up of two components for the purpose of what we've outlined in our resource, and that's one, expertise and trustworthiness. And so this means that your messenger, who is out there sharing this information, is just as important as the misinformation that you're addressing. So make sure that you choose your communicator wisely when there's opportunity to leverage, again, someone in your community, a trusted voice, partnering organization, someone specifically in your team that has a very specific expertise. Just always be strategic in making those decisions. Next slide. So combating misinformation with partnerships. This is kind of part two of this. So collaborative partnerships are really invaluable in helping you address misinformation. A successful partnership, offers a number of benefits to help your program accomplish your goals. And some of those things could be like keeping track of hearing, being that earpiece of hearing, what's being said in your community and giving you that kind of advance opportunity to correct some misinformation that's circulating. In this graphic, we have a couple of, actually 3 different types of partners, but I wanted to call your attention to the messaging partner. So they are a way to address misinformation directly. They're basically a dissemination partner or a megaphone that's out there working on your behalf. So they're foundational to the work that you're doing because they help amplify your program's message, and then they also expand the reach of your messages that you have. So these types of partners are willing to share your messages with their audiences in their settings. So this could be digital sharing, whether it's through their newsletters, it could be in person at events, stakeholder meetings. It's just really a coordinated approach to message dissemination that helps your program address and accomplish several key strategies at the same time to address misinformation. Next slide. So this slide is a visual of how to achieve community buy-in, and you get there through community engagement. And we have 3 touch points that we've identified. So communicating, educating, and collaborating. So community engagement is about creating opportunities for communication, education, collaboration, and partnership. So it's a way to establish this two-way or bi-directional communication through intentional interactions between your program and your community. And when you do that, these interactions help you get a better understanding of your community's needs, concerns, even pain points and challenges that they're experiencing. So when we start first with communicate, some guiding principles that you need to keep in mind when you are communicating with your community is always be transparent, particularly about key decisions that you know may have some ripple effects in your community. Always share, logic behind that, what may have motivated you to make that decision. Be honest, send regular communication updates, use jargon-free language, always be clear and simple whenever you're sending out messaging. Use inclusive language, use a mix of communication channels, create accessible formats, of course, alternate languages if available and as appropriate to the demographics of your community. And again, if you can pull in some messaging partners, that's always great too. Looking at the second piece of educate, this is my favorite area. So this basically means you're going to use activities to establish information pathways to your community members. So this means that the people in your community know where to find your program and other key resources that are in your community. So you kind of can approach this in thinking about topics and activities. So topics that you may want to educate your community about could be your program goals and objectives, maybe the direct and indirect benefits of your program, maybe youth testimonials talking about what the youth experience is. Could talk about positive youth development and resilience. The list can go on and on for topics, and then activities that you might want to do to educate. You can have social clubs, family days, local events. You can go the route of more media, local radio op-eds, newsletters. Again, there's a pretty exhaustive list of activities that you could consider that create these information pathways and allow you to begin to interface with your community. And then the last one, collaborating is kind of taking it to the next level. That's ideal. So when you're collaborating with your community, now you're actually maintaining that dialogue and it's helping you deepen what you've learned about issues and pain points. And so this collaboration piece is really what begins to build community. Or collaboration cultivates community, 3 C's. And again, you can take that same thought of topics and activities. What is important to your community members? What community assets do you think your youth need? What do parents need? And so activities that come to mind can be things like community mapping, again, your public meetings and workshops, web-based engagements, community coalitions, places that really allow you to get in there and interface, rub elbows with your community and have meaningful conversations. Okay, next slide, please. Thank you. So dissemination, basically presenting your program to the community. Dissemination is a dynamic process where you're sharing information with the members of your community, again, parents, caregivers, stakeholders, and wider audiences. And this is really where all of your hard work comes together. If you have a dissemination strategy, it will ensure that your key messages and the other important pieces of what you're doing come together and that they reach the right members of your community. And when you have this done in a timely manner, it can help shift narratives and also neutralize misinformation. So I want to take a minute or two to talk about this action planning tool. It really helps bring together all these pieces into one place and helps you finalize your overall approach. So looking at that first line, that dissemination goal, that why, again, are you wanting to raise general awareness? Are you wanting to educate your community? Are you looking to address or counter misrepresentations or misinformation? That's always important. Your key messages, whatever it is that you've decided that those are, and your dissemination products, figuring out what would be most useful and most helpful, what format in sharing this information. And so you can think, do we want to take this through social media? Is it going to be Facebook? Should it be a YouTube video? Should it be Snapchat, podcast, news media, newsletters, very long list, infographics, tip sheets, etc. And just making the determination of what would be the best format. Who should share that? That's getting back at that credibility, that trust. Is there someone that there's a trusted voice within your organization or a partner with your organization, et cetera, that can best put forth this message? And then determining how you want to share this. And so thinking about dissemination channels again, which kind of gets into the social media piece. There are a number of strategies and tactics that you can choose from. And then the final piece is, when will you share the final product? So are there certain things that you can leverage, whether it's an upcoming event in your community? Are there national holidays that are relevant? Just being very strategic and proactive about the timing of it will always help it kind of go forward. Alrighty, next slide. Okay, so presenting your program to your community, now that you've disseminated your messages and they've had some time to percolate throughout your community, it's time to monitor and to also measure your activities. And this is really important because it helps you know what's working, what's resonating within your community. Are there specific strategies or tactics or framing that just seem to really do well? You get a lot of engagement there. So your metrics will be based on the type of activities that you've decided to do. So that's important to know. So for the time being, we'll focus on existing communication channels. So if you have, newsletters, your social media, et cetera, in terms of reach and engagement, you'd want to know if we had a newsletter. So how many channels did your message go out into? For example, how many partner newsletters contained X message about positive youth development? So you'd like to know how many. Did that number increase? Did it hit whatever your target was? And then it's also important to know, how many people subscribe to, if it's a newsletter, that received that message, number of times that particular message was included in different channels. Those things are really important, and those are kind of initial examples of things you can keep in mind. Engagement measures are really important because that's telling you how your community is engaging, interacting with your messaging. So feedback from partners and users is sometimes something that you'll hear, whether someone contacts you directly or you're starting to see commentary online, or if there's any sort of evidence of like a visible action that has taken place. So if there was a call to action in an advertisement or some sort of messaging or at a meeting, and then you start seeing people actually doing that thing, you can count that as engagement measures. So those are two examples of how you measure your reach as well as your engagement measures over time and see kind of where your momentum is, and you can make adjustments accordingly. Next slide. We're in the final stretch here with recommendations. So now I'm going to walk you through some recommendations for each of the pillars that we've talked about. So messaging, misinformation, and dissemination. These are really straightforward because we wanted them to be as literal as possible. And so the first, to expand program messaging beyond sexual health education. You really want to develop messages that highlight your program's broader values, because that's where you do have that common ground. You can get that resonance, and do the positive framing that we've talked about. Again, positive framing to present your program as a solution to many of the challenges that youth are experiencing and helping to move them along that path to adulthood in a successful way. And always make sure that you develop a message strategy before you communicate with your program. That'll help you work through some of those details of what you're saying, why you're saying it, how it should be said, when it should be said. Next slide. Here is our first round of misinformation strategies. So always approach misinformation with a coordinated strategy. As I mentioned, it's complex. It's not just a one and done. It's something that you're going to have to kind of come back and chip away at, and be pretty consistent to address or manage it in your community. have internal and external plan to monitor and initiate communication about misinformation in your community. That's just keeping a pulse and knowing like, hey, this is happening, this is being said. Does this warrant our response? If it does, is it something that we can address, or do we need to reach out to our partners and let them know here are some messaging if you hear people saying these things? It's just one approach that you can think about. And then always avoid restating dangerous myths and other misinformation. What we call it, do a truth sandwich. If you have to restate it, have truth, state the myth, and then follow it up with truth so it's framed properly, not to leave people with misinformation. Next slide. So this has a community engagement focus. So creating communications that are transparent, that are useful, that are easily accessible through multiple communication channels. One person might be on Facebook or any sort of social media. Another person may only do email or may only read the newspaper. So just be broad in your approach so that you make sure that you're able to reach the various folks in your community. When you're sharing information with your community, always think about what is important to them, what are their values. That helps with framing and giving context and gaining resonance and traction for your messages. And don't forget to listen to your community because it is the foundation to community engagement. Next slide. We added this one in here because we thought, youth are allies, they are your ambassadors. And so it's important, this is kind of like a two-way street here, encourage the critical thinking among your program youth and promoting health literacy and media literacy. So you're helping them begin to take a critical eye to the information that they're hearing, and also train them on how to respond to misinformation, because if they're choosing to address it, you don't want to get them in a situation where they are, verbally attacked or just in an awkward or difficult position. So give them the skills and say, if you choose to do something, whether it's with your peers or if you hear your parents say something, give them some clear, defined approaches and strategies to do that so that they are protected. And then the last one here is encourage youth to use their voice in their community to address misinformation. So this can be simple things like testimonials about what their experience has been, how their life has improved, accomplishments, successes as the result of your program. And they can do that through their online social media presence, and even in social settings with their peers. They can just look for opportunities to share about programming. Next slide. And I believe this is our last one. So dissemination, do not underestimate the power of an action plan. And this is that screenshot of the plan that we shared before. It does walk you through just step by step and allows you to have a cohesive picture of what your approach is and think through the finer details. It's easy to kind of just say, this is what we want to say and jump out there. But when you think through that, you can have a more clear, coordinated strategy and approach. Always regularly review and analyze your dissemination activities, and then use insights from your reach and engagement to measure and inform and refine your future activities. So it's an adjustment. It's kind of like a self-test that you can do and see, again, this works, this is not working. We should do more messages like this. If we package our messaging in this format, it seems to get broader reach, more engagement. And so those are our recommendations for community support. Next slide. So again, this is our resource that is forthcoming. Once it is available, we will make sure that folks receive an e-blast announcement about it. Again, we're very excited about it. We're still tweaking some of the design, and we do have a new title for it. We've lovingly referred to it as the community support resource. And some of you on here may have been tapped for name recommendations. And so we have a winner. And so we're really excited about that. So we'll hold that close to our chest, but you'll see some version of this cover very soon. Next slide. So at this time, we want to open the floor to questions. And if you have any questions, please drop them in the Q&A, and we'll make sure that we address those.
Ty, I just want to call attention to Patrick's comment also. in the chat that there will be a post-event survey as well. And we do appreciate everybody's feedback on this today. So
Yes, thank you. Thanks, Brian.
Taya, one type of question which came in just while you were talking, I'll just offer this generally here, and then there's another question which just came in as well, but just instances where people might be wondering about the goals of a particular project. Are there strategies or tactics for addressing concerns that might come up sometimes, and I put an answer in the chat here about the importance of again trying to figure out what shared goals might be held with the community, emphasizing what those goals are, but also being transparent sometimes about the goals of activities can be useful. We've got another question, Ty. It looks like this coming from Regina about whether or not there's an estimated time of when the resource will be available. A week, a month, so people are eager to get this, which is good. But do you have a sense, Ty, of what the timeline is going to be?
It'll be early 2024, because I don't anticipate, because we've got 2 weeks before our folks are out for the holidays. So probably early in the year, January-ish, maybe February.
Great. So the timing of this webinar was good then in terms of previewing that. It'll be right around the beginning of the year. So excellent. We got a question here from Tony and asking about whether they can get a copy of the presentation. And Ty, I think there are plans to post slides or make those available. Yeah,
we're definitely going to have a recording available on the exchange and the transcript from the meeting. Also, I need to confirm about the slides, but at a minimum, you will have the recording to reference.
Yep. Thanks for that, Tony. Okay, we'll look here both in the chat and the Q&A to see if there are other questions people have. Tonya, thank you. We've got a thank you that's come in, Taya, so for this session. Chloe's got a note here for folks in the chat as well, that we've got slides here that at least some of these will go out in an e-blast after the webinar. And then eventually the 508 compliance slides will be available on the exchange. While we're waiting to see if there are any other pressing questions people have, if any of what we've raised here it really resonates with the experiences that you all have had, we always love to hear, what experiences projects have had as well. So certainly feel free to share any of that in the chat as well. And Taya, I guess one other question in terms of distribution for the newly renamed community support resource, so that people will be aware of that, I think, through an e-blast, right? And then it'll also be on the exchange.
Yeah, we'll promote it broadly and widely.
Okay, great. Yep. Excellent.
Okay. Well, we can keep taking questions, but Patrick, you can move us along to our next slide, please. Thank you. So here are some resources that are currently on the exchange. We have a handful of webinars, some from PrEP side, misinformation in public health, implications for personal responsibility education program grantees, also building brand identity to mitigate misinformation and connect with audiences. We also have community engagement to tackle misinformation about adolescent pregnancy prevention. These are all really great webinars. We also have a podcast addressing controversy in communities, and then a resource guide about how to harness the power of branding. So we did want to just bring those to your attention. And again, soon we'll have an additional bullet to add under this list with the new community support resource. Next slide. Here are 2 references. We want to make sure those were available. And then next slide, as Patrick mentioned in the chat, well, here's our contact information for Brian as well as myself. And if you need any sort of training and technical assistance, please reach out to our SRAE inbox and someone will get back to you as soon as possible. And next slide. We will have a short survey that will pop up when you exit the webinar. So we just love to hear from you. It helps inform our approach as well as our topics, etc. So please take a moment to complete that survey before you sign off today. Any final questions? Well, great. Thank you so much for spending your afternoon with us. It's been a pleasure. We hope that you gained a lot of great information that you can apply to your programs. And we'll be in touch soon.
Thanks, everybody.
Thanks,
Thank you.
Taya. Thanks, Brian.